Yeah, skin changes. So he had blue lips. Because why was he having blue lips?
His heart's not pumping?
Yeah, the heart wasn't happy. So what it was doing was trying to take any bit of blood that was in the periphery that might have had some oxygen or something in it and bringing it to where it needed to go. Okay? And so what else was wrong with his skin? He was sweating because his body was in a panic state, right? Okay, so what are some other signs of a heart attack?
Clutching the chest.
Yeah, so chest pain. What else?
The arm hurts. I heard.
Do you remember which arm?
It's
Left arm.
Left arm.
Right?
Okay. What else? What are some other signs of a heart attack? Possible signs.
Indigestion.
Yeah. Possibly. Now, does anybody know why people sometimes think they're having indigestion and actually having a heart attack, or vice versa? Why?
Wait, are indigestion and heartburn the same thing?
Yeah.
Oh my god.
Yeah. Yeah. Okay, so think about it this way. Think about your anatomy, right? You have your esophagus with your lower esophageal sphincter going into the stomach where there's acid. Okay? Where's your heart?
Really close to it.
It's on the same plane. And some of the nerves that are nervating the esophagus are also nervating the heart. They're a similar plane that they go into the spinal cord at the same level, so the body just gets confused. Our bodies are stupid sometimes. They're brilliant, but they're stupid. We only know how to say, express a few things, okay? So it's just from the same plane. So if you have that Pepsid, here, take some Pepsid, it doesn't work, Okay, so what are some other signs of a heart attack?
Maybe a dumb question. I would love a refresher on what is a heart attack.
A heart attack is when the cardiac muscle is not getting the kind of blood flow or oxygen that it needs. That can be from a clot, or it can also be if someone's taking cocaine and cocaine has a preference for coronary arteries to go like this. Okay, so it can cause the arteries to actually clamp up like that. So you have multiple layers in the heart, and so basically it's starving from oxygen. Cardiac arrest, when you have to do CPR, it means the heart's just going, okay? It might still have some type of electrical activity. That's what the AED actually can run shock, but it's not pumping effectively for life. The heart attack is kind of like a precursor to the cardiac arrest. Okay? All right, what are the other signs of a heart attack?
Jaw pain.
Jaw pain. What else?
Can I just continue to clarify? Sorry.
Yeah.
So indigestion, that's the same thing as acid reflux.
Yes.
Okay, sorry, I'm just realizing these words are all synonymous when
Yeah.
I didn't think so. So now I'm like,
Now, sometimes with heartburn, indigestion, or acid reflux, that could actually be caused by H. pylori, which is a bacteria, and so you actually need a medication to treat the bacterial infection. So if you have ulcers or something like that, you can have a bacterial infection that's not under control. Or sometimes you might be drinking, and alcohol will actually cause that lower esophageal sphincter to relax, and so acid will get back up into your system, especially if you pass out. Sometimes people will have indigestion with spicy foods, and your body's just I don't really like this that much.